The idea of the Dedoc Voices Scholarship is to bring diabetes advocates from around the world to the largest scientific meetings like ADA scientific sessions. We've given some 600 scholarships over the last 5 years.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here at the American Diabetes Association annual scientific session with Bastian Hauck, the CEO and founder of Dedoc. Bastian, great to see you.
Thank you very much. Great to see you.
I got to get a sense of the power of what you've built at Dedoc on Friday evening at an event that you threw, and just the energy of the folks that you had brought together was really palpable and exciting, particularly around a program called Dedoc Voices. So tell me what that is.
So the Dedoc Voices program really is at the core of everything we do. It's the Dedoc Voices Scholarship Program. It is the largest in the world by now. We've given some 600 scholarships over the last 4 or 5 years to more than 300 something individuals from more than 70 countries. It started in Europe. Our strongest basis now is in Africa, India, Pakistan, and we're expanding into Latin America. And since last year, San Diego, ADA, the United States. And we work with diabetes advocates. We encourage them to apply. We get about 300 applications per conference. The idea of the Dedoc Voices Scholarship is to bring diabetes advocates from around the world to the largest scientific meetings like ADA scientific sessions.
And why is that important? What do they gain from that? And what do they lose by not having that access?
Well, first of all, we have 2 hashtags that we use to instead of a mission statement. One is pay it forward. So we give these scholarships and ask them to not say thank you, but to do something with what they learn. So whatever they learn here, whatever the network brings them, we ask them to go home to their communities in Uganda, in Liberia, in South Korea, in Pakistan, in Europe, in the US, and create something new, number one. The other one is nothing about us without us. That is our credo in terms of the us, that's people like me, people living with diabetes. So we want to make sure that the voice of people with lived experience, the voice of people with diabetes in this case, is heard loud and clear, and that these conferences are not just places for HCPs and researchers and industry, but that the people that the conversations are about have a say. And our Dedoc Voices have been tremendous in asking the sometimes uncomfortable, critical, but also spicy and interesting questions. Yeah. And that's why they're here.
Yeah, on Friday I got to step into that D-Data all-day innovation, and I'm guessing it was some of your folks who were at the mic asking some very pointed questions. And I think that made the whole event, to have people with type 1 diabetes, ambassadors, if you will, coming and pushing back against innovators. It was a beautiful sight.
It's not necessarily pushing back. They're very informed people who know a lot about diabetes from their own lived experience, from their own communities. Many of them are patient entrepreneurs themselves. They find their niches. Many of them are researchers. They publish in the Lancet and the BMJ, but always they will have different day jobs, right? But they are very informed, they are very powerful, and if you bring this crowd together, that's what you get. You get a group of people who will not step down, who will not step back, and they're not meaning to be mean or critical, they just want to know.
Yeah, to push the metaphor, they're not necessarily pushing back, they're like adding to the conversation with their lived experience. You must have so many stories. When you think about the people who have applied for the scholarships, the work they're doing, you said Ghana, well, just all over the world, and then they go back and they pay it forward. Any stories come to mind of just inspiring individuals who have been in that program?
There's 2 that I keep on repeating because they've struck me personally the most. One is a girl from Uganda who had never left the country, who applied to the Dedoc Voices program, and usually first-time candidates that we don't know, we would never bring them. We run symposia at each of these conferences. We gave her a so-called wild card, and she was on the symposium, and she delivered the most. Like half of the 600 people had tears in their eyes. That was one, and she is now running kids camps throughout Uganda every other week or so. Another one is Tino from Zimbabwe, who just messaged me a couple of months ago and said, Bastian, we are just starting this education camp for diabetes nurses at Harare, the biggest hospital in the country. There's 200 nurses and diabetes team people coming, and there's doctors from all over the country who will give lectures, and they're all volunteering, and we have it all figured out. but can you connect me to one of your sponsors for financial support, because we need to at least be able to provide water, coffee, and tea. I was like, Tino, what do you mean? How much do you need? He's like, yeah, we did a rough calculation for the 200 or so participants. We need $143. I was like, Tino, give me your bank account or Western Union. I'll send you more. Make sure there's some good food on the table. And then he sends me this. He sends me this picture by WhatsApp just like 2-3 weeks ago with all these people celebrating and some of them holding a Dedoc sign. I mean, we didn't do anything, but he just created this thing out of thin air, plus the network, the peer support, asking others for advice, etc., and learning from these conferences, and then just. He didn't ask for help. He asked for $143. Wow.
My sense is that when your community comes together at an event like this, there are things that they learn that are exciting, and there are probably also some frustrations. You come and you think, why aren't certain things moving faster? Why isn't this a reality yet? Just talk to me about that spectrum. How do you balance the optimism for what's possible with the sort of necessary frustration that pushes the field forward?
One of the most striking examples of how you can transform frustration into movement is the We Are Not Waiting community. And that's probably closer to your field. You know, the DIY community, the people that were reverse engineering, hacking insulin pumps, connecting them to insulin sensors years back, before any of the industry players were doing that. And we received a grant with a group of universities, etc., and Dedoc was the industry partner for that, the Open Project. 1 million euros from the European Commission to bring together patient researchers, but also researchers from universities and research institutes to do more on the algorithm development, on studies for safety, on the psychosocial cost of living with diabetes versus living with diabetes aided by such a system. It made a huge difference. It came out of the frustration. The technology is there. The pumps are here. The CGM sensors are there. Why don't they talk? They all use Bluetooth. Why is nobody doing that? Yeah. The only red tape was regulatory and the fear by some pharma and medtech players that who is responsible if something goes wrong. And then the community came together and proved that it is safe to use. And I mean, almost every pump I know now is connected to a sensor.
Yeah, it's amazing. Anything in particular that you're excited about in terms of the innovation that's been here? I know there was an innovation challenge last night. There's been a lot of small startups. Anything you're seeing?
There is a lot. I mean, I find it very interesting that formerly JDRF has rebranded into Breakthrough T1D, and I talked to their leadership team yesterday after they announced the grant that they are giving us. They made this brand change, because it's no longer just juvenile, but also because they truly believe that this breakthrough is, meaning the cure, is around the corner. And we've heard that for decades, 5 years. In 5 years, there's going to be the cure. But we are getting very close to the breakthrough. And that is, on a more general level, what I'm really excited about.
Bastian, thank you for taking time with me. Thank you for building the Dedoc community. Thank you for sharing those stories. And I wish you the best in the next year.
Thank you very much.
All right, thanks.